patient, 82 years old, monocular, functional, who was referred to us after a number of different treatments. So the right eye has a traumatic aniridia and a retinal detachment in childhood, no light perception. On the other side, on the left, we have a retinal detachment about 20 years ago, and he refers of recurrent keratitis. In this keratitis history, he has probably overused, abused of local antibiotic eye drops, and the patient also reports multiple grafts of amniotic membrane and use of contact lenses, and the visual acuity is quite low. When he presented to us, he was on antiviral treatment with addition of topical steroids. So my question is the following. What is the diagnosis? What do you think is suffering from HSV keratitis, active post-HSV leukoma, or limbal stem cells deficiency, or neurotrophic keratopathy? Question mark. I think the answer is correct because we thought that it was a limbal stem cell deficiency. Considering the treatment that he had been on and the use of contact lenses, the limbus had been reduced. And so we thought what to do by means of an aggressive intervention and a keratoplasty, so Boston K-Pro or keratoplasty or panectomy and AMT, or another attempt at amniotic membrane or a conjunctival limbal transplantation. Great. So everybody agrees on transplanting. Also graft, conjunctival limbo, autograft. So, but what sort of transplant? From cadaver, conjunctival limbal allograft, or living related conjunctival limbal allograft, or cultured or cultivated limbal stem cells transplant? Perfect. So we also opted for a CLAU. As it has already been said, this is an extremely safe and sure technique that may guarantee a good outcome. Also because we have a patient who in the fellow eye had an entirely healthy eye, and therefore harvesting from that eye wouldn't be risky, not even for the visual acuity. And then consider that this is an elderly patient, and this means that we shouldn't use immunosuppression, and especially there were a few risks of surgery failure. And this is what the appearance at a few days after surgery. This is the post-op picture after 1 month. Now, after 8 months, the surface is perfectly clear, and the patient has nearly 10